Are you fond of eating fast food? Are you getting enough sleep? Are you stressed? Your lifestyle choices might be predisposing you to stroke. I'm Dr. Filipinas Ganchoon. I'm the chairman of the Physical Rehabilitation Medicine Unit of the Doctor's Hospital. I'm a physiatrist, I'm a physical rehabilitation medicine doctor, and I treat patients with neurological disorders and pain. There are many challenges that stroke survivors encounter post-stroke, and it's very important that they have comprehensive rehabilitation program so that they can recover fully. So the first is primarily physical problems. So they have paralysis, they cannot feel. So usually when you have a stroke, half of your body is paralyzed. You have numbness. So another complication is dysphagia. The food that they take, the water that they drink can aspirate, can go to their lungs. Other complications are deep venous vein thrombosis. If you have been lying down for a long time, your blood is not moving, it's not circulating, it forms a clot. Other complications, pressure sore, contractures, so many complications with stroke. So that's why we have to have early mobilization to make sure that the patient can fully recover. Early rehabilitation is critical in stroke management because there is what we call a golden period for recovery from stroke. So within 24 to 72 hours, once the patient is medically stable, we initiate physical rehabilitation. What is the advantage of early initiation of rehab? First, it optimizes functional recovery because we tap into the brain's neuroplasticity. Neuroplasticity is the brain's capacity to relearn and to be reprogrammed because during stroke, part of your brain is damaged. So we teach the patient rehabilitation exercises which are task-specific so that the patient's undamaged brain can be trained to take over the task of the part of the brain that is damaged. Benefit is best functional outcome. Once you have a stroke, you cannot speak, you cannot eat on your own, you are paralyzed, so you cannot move. So when you start early rehabilitation, we assure best functional outcome at the earliest possible time. So the patient will be able to relearn their ability to sit, stand, and walk, and also be fully independent in activities of daily living once they had early rehabilitation. The Doctor's Hospital has a multidisciplinary approach to stroke rehabilitation. Usually it starts with the rehab doctors working with a neurologist and the neurosurgeon. Then we work with our rehabilitation team, our physical therapist, our occupational therapist, our speech therapist, and our rehab nurse, and also psychiatrists, social workers, recreational therapists. They're all part of the stroke management. Currently renovating its rehabilitation department, and we want to focus on the heart, lung, and brain rehabilitation. And currently what we're providing the patient is we have functional electrical stimulation, gait training, balance and coordination training, but we are in the process of procuring robotics so that we can use advanced technology to help our patients, stroke patients, recover faster. We noticed that stroke patients are getting younger and younger, and it's because of the change in our lifestyle now. We can prevent stroke by lifestyle modification. First, you have to avoid smoking, alcoholic beverage drinking, ensure that you have a plant-based diet, exercise, have moderate exercise, 30 minutes, 5 days a week. So make sure that your blood pressure, your blood sugar, and your cholesterol levels are normal. So stroke rehabilitation, especially early intervention, is very important so that you will recover your full function at the earliest possible time with best outcome. So Doctor's Hospital is here to provide you with the best care. In stroke, you have fully trained doctors, and also our staff is also well trained to give the necessary treatment that you need. And we are coming up with technologies that could further assist you in your stroke recovery. Currently, the Doctor's Hospital is providing inpatient stroke rehabilitation. In the near future, we will be opening our outpatient department for stroke management.